If you need to transfer a patient from the bed to chair or chair to bed and the patient requires a lot of assistance and cannot use a walker, you can perform a squat pivot transfer with the patient. Follow these steps to safely transfer your patient. Begin with the patient seated at the side of the bed, feet on the floor, and gait belt applied. The chair or destination surface should be at about a 45-degree angle to the bed and placed right next to the bed. You should stand with a wide base of support. Grab the patient's gait belt and have the patient lean into your opposite shoulder so that their hips are pointing in the direction of the destination surface. In this example, the chair. Next, interlock your shin with the patient's shin. To do this, you will cross your shin over the patient's, with your foot on one side of their lower leg and your knee on the opposite side. Regardless of which leg you lead with or which direction you are pivoting, you will cross your knee over the patient's leg by bringing it toward your midline. If you're leading with your right foot close to the patient, and the patient is pivoting to a chair to your right, your foot will go on the outside of the patient's left foot, because their left foot is closest to the chair, and you will bring your knee toward your midline, and lock your shin by pressing your knee into the inside of the patient's leg. By interlocking your legs like this, you prevent the patient's lower leg from being able to slide or move as you pivot the patient, with your shins interlocked and the patient leaning to your opposite shoulder, and while holding the gait belt. Shift your weight back onto your back leg and bring the patient with you. Their bottom will lift off of the bed, and you can now pivot the patient and lower them into the chair. If the patient requires more than a one-person max assist, an additional healthcare worker can aid in the squat pivot transfer. The helper will stand between the bed and the destination surface, standing with a wide base of support. Their purpose is to provide additional support during the transfer. The primary healthcare worker will follow the same steps as with a one-person squat pivot transfer, and with the patient leaning forward and the shins interlocked, both healthcare workers will help lift the patient using the gait belt and guide the patient's pivot to the chair. The movement is the same, but the additional strength from the helper will make this transfer safe and smooth.